It's very important that we make a careful diagnosis, of course. So if we can have the spouse who can comment on current symptoms and the duration and the severity, it's also important that we have somebody from the past in childhood who can comment on childhood onset of symptoms and impairment. And if we don't have a parent because they died, because they are demented, because they don't see each other anymore, which is frequent in ADHD, by the way, we can make a diagnosis, because research has shown that the patient is the main informant and the best informant regarding inattentive symptoms, for instance. So hyperactivity, the environment can see from the outside. Hyperactive behavior is obvious when it's more than normal, or more than compared to age reference controls. But inattention or being dreamy or easily distracted is not so easy to see for the outside world, not even parents if they are not aware of it. So it doesn't mean that the parent always has the best answer. It means that he never knew 40 years ago what to look for, because he didn't know about ADHD in the child at that time. And so he's not always the best informant that we might consider him to be. The spouse is also not the best informant, although we appreciate the severity, to have an estimation of the severity and the frequency of symptoms. But the patient is the one who knows himself the longest. And he can also reflect on the more internal symptoms of inattention and disorganization that he suffers from.